Good afternoon. This is Carrie Lynn Coleman with Collaborative Planning Group. Thank you for joining us today. We're going to go ahead and get started. As I said, I'm Carrie Lynn. I am the CEO and President of Collaborative Planning Group. CPG provides innovative technology solutions for prevention organizations and states. We work with prevention providers, coalitions, and states across the country to assist them in documenting and evaluating their work. Since March, everyone's world has been turned upside down due to the pandemic. But the work that prevention organizations have been doing since March is truly inspiring. You all have relied on your knowledge of public health and your community engagement skills and relationships to meet the needs of communities that you serve. So we wanted to highlight some of those efforts in today's webinar. We're going to share how prevention has adapted to continue to deliver services under these new conditions. We're going to hear from 3 community service boards from Virginia. First, we're going to hear a little bit about the prevention infrastructure and kind of what's been going on in Virginia related to COVID, since so many things are different across the country. We wanted to give you a sense as to how things are organized. Then we're going to highlight the 3 community service boards and what they've done. Following that, I'm going to share some highlights from a few other states that have coalitions and providers who've done some really unique and innovative work given the current circumstances. And then Julia Simhai from Omni Institute will discuss how we can use data to guide our future prevention efforts. We're going to leave some time at the end to take some questions from you. So if you have questions as we go through, please feel free to submit those via the Q&A, and we'll make sure that there's a few minutes at the end that we can answer those questions. So Julia, I'll let you go ahead and introduce yourself.
Great, thanks Carrie Lynn. Like she said, I'm Julia Simhai and I work for Omni Institute. We are a nonprofit social science consultancy that does integrated research, evaluation, capacity building, and data utilization services. At Omni, we've worked on several prevention-focused projects over the years and currently, and so we sort of took into account all this experience to help our partners navigate the past few months of work, including the Virginia communities that you'll hear from today. I'll give a little bit of background on how prevention is structured in Virginia. The Virginia Department of Behavioral Health and Developmental Services, or DBHDS, is the single state authority in Virginia for major SAMHSA grants and behavioral health and substance use prevention. They distribute all of those federal grants to the 40 community service boards across the state. And so those CSBs are the local entities responsible for providing many services, including behavioral health and prevention. The work that will be shared on the call today comes from a variety of funding sources, mostly the Substance Abuse Prevention Block Grant, Partnerships for Success Grant, and State Opioid Response Grant. So different communities are using different portions of that for their work. And all of this is funneled through DBHDS to the CSBs for impact in the communities. Over the past several years, DBHDS has also partnered with Omni and CPG to support all of the work the CSBs are doing and the substance prevention work at the state level. At Omni, we manage the evaluation, and so we work with every CSB to build their evaluation capacity, do trainings and technical assistance, and generally ensure that all their great work is being captured. CPG has developed the data system that CSBs use to track all of their prevention activities across all the funding streams. And so Omni and CPG have worked together to make sure the data system captures everything, and we're able to monitor for data quality and support the CSBs in reporting. And then we at Omni can extract data from CPG's system to do our reporting and evaluation work. So we've got a really collaborative group of players contributing to the prevention infrastructure. And then to give you a little bit of background on sort of what COVID has been like in Virginia. Virginia went into a stay-at-home order in mid-March. So all in-person prevention work and schools were stopped at that time, and schools shifted to an online format and stayed that way for the rest of the school year. In mid-May, Virginia started to move into a first phase of reopening. So some non-essential businesses with limited capacity could open. And last week, the state moved into a second phase of reopening, allowing for a little bit more to open up, still with several restrictions in place. And some areas of the state have been slower to enter those reopening phases based on local outbreaks or data on cases. So everyone is not necessarily in the same place, but there is movement towards reopening generally across the state. So now that you have a little bit of context on the infrastructure and the restrictions and what the world has looked like in Virginia, I am going to hand it off to our first community presenter to share how they have adapted prevention activities and remained successful during this time. So I will pass to Anton.
Hello, everybody. I am Anton Green. I am the Prevention Coordinator for the Hampton Newport News Community Services Board, and I'm also the leading organization coordinator for the Peninsula Trauma Informed Community Network. So with our Hampton Newport News Community Services Board Prevention Department, since the shutdown, we have been doing multiple coalition meetings. We are part of 3 different coalitions: the Community Builders Network, the Peninsula Trauma Informed Community Network, and the Peninsula Opioid Response Community Response Team. We've been doing coalition meetings and check-ins monthly, and keeping it separate, having our youth have their own time to connect and share their emotions and feelings on Zoom, as well as conducting some of our family programs with the Strengthened Families program and our Spanish-speaking parent circle. When we've also been doing some Facebook community awareness, and then in the beginning of March, we did a Resilience Week, which I'll talk about a little bit more later. So with our Strengthened Families program, we were able to do some in-person and in Zoom to finish out our program. And go to the next slide. We conducted a Strengthened Families program for the 10 to 14 age range in partnership with the Newport News Family Engagement Specialists. Like I said, we were able to do 4 weeks in person, and then the shutdown happened, schools closed. So we finished the program doing 3 weeks in person, 3 weeks on Zoom. The way that we did that was on Tuesdays and Thursdays. We conducted the program. On Tuesdays, we had the parents for an hour, and on Thursdays, we did the youth for an hour, and then the families for 30 minutes. During that time, we were able to have their family meal delivered to their homes via DoorDash weekly for participating, and also received incentives mailed to their home. And then at the end, they received a certificate and a graduation gift for completing the program. We had about 43 individuals complete the whole program, with 31 being youth and 12 being adult. The feedback that we got from that program was that they felt the connection in the programming and the activities done in person the same doing it on Zoom. There was really a connection building upon those individuals and those families that we had. Next slide. And like I said, the other event that we did during the shutdown has been the Resilience Week. We conducted a week in partnership with the statewide Trauma-Informed Community Network for our Peninsula region, which is Hampton Newport News. We conducted that the first week of May, where we had 3 interactive Zoom sessions that focused on mindfulness and exactly what is trauma-informed and how to be resilient, and then focusing on self-care. We did daily email blasts, which we reached about 125 people. And then on our Zooms, across our 3 Zooms, we reached 521 people. And then we also shared our information on Facebook daily, which reaching over 600 people. And with our Facebook, we have been doing weekly and pretty much daily posting about mental health and mental health resources for your young people as well as adults and families. Some COVID-19 health and community response. We participated in our prevention week via Facebook, sharing resources, information about the different topics about substances and mental health awareness. We conducted a Give Local 757 fundraiser campaign to provide resources to the community during this time, where we started creating our hashtag, which HNNCSB, we are connected. And across that, we have done, like I said, about 45 posts, reaching over 12,000 people. And then some upcoming events that we have, we're going to continue, even in the reopening phases, to do more things virtually, to give that social distance and providing that technology piece to those that are able to do, and then do some things in person as well. We have a Revive training coming up virtually. Our Coalition Community Builders Network is doing a youth internship virtually and in person, where they'll be receiving leadership and community development and leadership development trainings virtually, and then doing the internship at various sites. Doing some mental health workshops, attending the mid-year CACA conference, and doing some more resilience and self-care workshops. Doing our World Cafe to focus on trauma, ACEs, and resilience for different communities throughout Hampton and Newport News. Doing some virtual conferences for opioid epidemic for the region, as in the Tidewater region of Virginia, and also for our high school students that are connected to those athletes, the athlete programs in the different colleges and universities, having those directors do some pain management and medication management. We'll also be having some media campaigns going on the radio and TV, and continuing our awareness on Facebook and through our website there, hnncsbprevention.org. Thank you.
All right. Just wanted to thank Omni for the opportunity to present. My name is Shakira Williams, and I am a prevention and wellness specialist with Blue Ridge Behavioral Healthcare. And I also am the director of the Roanoke Area Youth Substance Abuse Coalition. So a small summary of what I will be going over today. A few highlights: our social distancing challenge, our Facebook and social media presence, some of our coalition meeting successes. I'll talk a little bit about our COVID-19 website page, and then just going into new projects and process. Next slide. One of the activities that has received probably the most attention, I would say, is the social distancing challenge. I have had people reaching out from a lot of places, even as far as Kentucky. And so the reach, I would say, and the success of the challenge has been far. The challenge was created after school was permanently canceled for the school year and moved online, and our stay-at-home orders were in place. The purpose was to keep our teens engaged physically and mentally healthy, and also allow for some creativity. Winners of the challenge were incentivized with a $50 Amazon gift card. What you can see on the left are just little snippets from this social distancing challenge. It is not the whole challenge, and that actually can be viewed on our website at raceact.org. And to the right, I just included 4 photos that were submitted by our teen participants. They earned points depending on which photo was submitted, and the teens at the end of the challenge who had the most points were the ones who were the winners. The maximum amount of points that you could get for this particular challenge, which ran 30 days, was 83. Next. So the next are our social media successes. We run a Facebook page, an Instagram page, and we have Twitter accounts. We have taken a lot of time to invest in our pages. Our Twitter and Instagram pages are run by 2 high schoolers. This gives them some responsibility and helps with continued participation. They're also much better at Instagram than any of us could be, and so they do a great job on their own just with engagement, posting, and staying current on prevention. And then Facebook is what you can see here. At the top, you can see for the last month, our post reach were about 50,000 people. And at the bottom is just what our homepage looks like. We do try to stay current in our posts, and we try to update our page often. To the right, you can see one of our last posts. Again, we try to stay afloat with current events, and we are champions for healthier communities, and sometimes this means getting involved with touchy subjects. And if you work in the field of prevention, then this is not anything new. And so it seems to be really successful. We get a lot of engagement on social media. Next. Our coalition meetings are the last current thing that I'm going to talk about. Since we have been at home, we've done 2 virtual meetings. The feedback that we've gotten from these meetings has been very positive. People, I guess, feeling like it is the most engaged that they have been to, and most engaged meeting that they've attended online. I typically do an icebreaker for each meeting, and so you can see at the bottom on the left side of the screen, show and tell. That was the most recent activities that we started our coalition meeting out with. At the top, and I'll talk a little bit about this tool later, they were asked to describe their quarantine in 1 word, and they could watch in live time on the shared screen the word collage as people were submitting their answers. I do start my meetings out with Zoom etiquette, such as muting, using the icons. I do encourage people to stand up and stretch, and I also encourage people to use the chat box. Usage of the chat box really helps to keep people engaged because they can chat with each other and ask questions as your presentation goes on. Next. And some projects that we have in process right now, we are working on a camp in a box. We plan on stuffing about 200 boxes with 4 weeks worth of activities, and those will be distributed to elementary school up to middle school age in our community. We are planning a youth leadership conference. It'll be a 2 to 3 day conference with our teams, where half of the day is spent on prevention activities such as the SPIF and logic model, and the other half will be team building such as ropes course, hiking, and things of that nature. We're also working on an anti-racism resource page. It will be similar structure to our COVID-19 page, which you can see on our website at rasac.org. We will be posting books, movies, articles, websites, anything that really helps to promote the conversation toward a healthier community. Next slide. So this last slide just discussed some of the tips that I would have, and these are all things that I do whenever I'm planning anything. I would say to stay on trend, current events, social media trends. That's really important when you're trying to engage with the community or with youth. Research, I do research everything. 2 of my go-tos for research are Google Scholar for peer-reviewed and academic resources, and Facebook groups. I'm a part of several different Facebook groups, from Volunteer Network, where people ask questions about facilitation and things of that nature. You can swap ideas, people post things, people share ideas and discuss successes. It's actually a great research tool. Diversity and inclusion. One of the reasons I hear most often for why something may not be representative of diversity-wise is that they couldn't find pictures, whether they couldn't find pictures of disability or pictures of people in color. I tell everybody I use Pixabay and I use Pexels. Those are free open source photos that you do not have to give credit to the photographer. And when it comes to inclusion, I ask who can't participate. That just kind of helps to point out the barriers, and maybe you can go back and tweak some things to make sure your activities are more inclusive. For engagement, again, I use icebreakers. I try to use icebreakers that promote conflict resolution, teamwork, and critical thinking, rather than icebreakers where people have to share personal information or could be put in a position to overshare. And again, I also use presentations instead of just agendas, and I use the Zoom breakout rooms. For facilitation tools, the word collage that you had seen earlier, that was from Mentimeter. So that's mentimeter.com. There's several different things that you can do to promote facilitation, and people can view the results live. And I also use Trello. I use that for productivity, project management, and facilitation. And lastly, I would just say consistency and follow through. Do the things when you say that you're going to do them. Even if you think that nobody will show up, it's still important to continue to follow through. And remember that Rome was not built in a day. Thank you.
Hello, everyone. My name is Whitney Kern. I'm a senior clinician at Chesterfield County Mental Health Support Services. I have been lucky enough to work in the prevention department for almost 27 years now. I am going to talk first about some of our parent education work. So we do 3 different types of parent education throughout Chesterfield County. One is the parent consultation. That's individual meetings with families. When we had to transition, we transitioned, I think, fairly easily over to the phone. Some people have stayed with that, mostly because they don't have the capability with their computer to do virtual chats. But most now, I would say, have transitioned over to virtual chats. We use Microsoft Teams. I have been asking the families that I work with what their opinions are about that, and I've gotten a lot of very positive results. I personally think prevention work and psychoeducational work lends itself very well to telehealth. What I'm hearing from the families is that there's easier scheduling. They can go from one activity to the next. And I would also say for me, I can go from one activity to the next fairly quickly with a virtual chat. It's obviously less travel, which can be helpful on a number of different levels to families. A lot of people are talking about they just feel more comfortable in their own home talking about what's going on with their children. And some have reported feeling less stigmatized from having to go to the mental health center, or even some families don't necessarily have the best relationship with their school, because we used to do a lot of consultation in the schools. From my perspective, I see 2 real great things about doing parent education consultation virtually. One is I get to see the families in their own environment. So for example, this morning I was consulting with a family of a 4.5-year-old who was having some pretty significant behaviors in their playroom. And mom said, well, would you like to see the playroom? I said, great. And she brought her laptop into the playroom, and we were able to really change up different things. And I actually saw some really great behavior from him that we were then able to work out right there in the moment. The other thing that I've really enjoyed is that I can coach families in real time. I happen to be a young child person. So what I'm calling back in the day, the children were not present when I was doing consultation. Now sometimes they are. So another family that I was working with, her 3-year-old was sitting right on the couch, and she said to me, "What do I say?" And I told her, and she said it, and the technique worked. And it was kind of like, wow, I normally don't get to do that. So I feel like there's some really good things with consultation that we can do in the virtual world. We also do a fair amount of workshops and classes. We have a lot of existing groups here in Chesterfield County, both parent groups and other community groups. We also found that other parent groups and community groups formed very quickly after the shutdown. We were pretty easily pulled in to different workshops to be able to present the same information that we had either been scheduled or they wanted to schedule through that virtual reality. We are planning a bunch of different summer workshops, both for parents as well as other families throughout August, September, and even in July, a little bit in July. Our classes obviously took the most work on all sides to move virtually. I have to give a huge shout out to our administrative assistant and our IT folks, because I will tell you flat out, honestly, I am not the most tech savvy person in the world, and they really supported me as the content person to be able to give this information out to the folks who needed it. We teach our court-ordered parenting class for families and parents that are getting separated and divorced, and that was the first thing that we led on Teams. We're also working on our active parenting of teens and tweens class that's going to come out in July. One of the things that I learned and just thought about a lot in a webinar during this time was the presenter was saying, you know, the way you present in person, you can find ways to present that virtually. And that was one of the things that I really took into consideration. For some of the smaller groups, I would actually stop the conversation. And if it was a PowerPoint, I'd stop the PowerPoint and we would discuss the situation. As we move forward, we're going to be using more of the polls, and we also use Mentimeter. We're going to be using more of that to engage folks in the material that we're talking about.
So we also shifted pretty quickly to doing communication via social media and videos rather than in-person classes and workshops. Unfortunately, we lost our marketing and community outreach specialist to furlough, which meant that I had to take over the Facebook. And I am a bit of a Facebook novice, but learned quickly, and I'll share with you guys just some of the tips that were shared with me if you find yourself in those shoes too, kind of doing something that you haven't done before. So we decided to launch a Calm Caring Chesterfield campaign from a prevention Facebook page, which provides daily tips on topics related to practical ways to cope and relax, maintain important social connections, and do things to positively impact others. Communications and media, we're part of a county, so they met with me to give me some tips, and they taught me how to use Canva, which is free online graphic design package that is easy for a novice to figure out and make some attractive Facebook posts. They also kind of gave me some guidance about how Facebook posts are pushed out based on their content. So that posts with video are pushed out more than posts with photos, which are pushed out more than posts with text. So that helped me to kind of think about how I crafted my Facebook posts. And they encouraged posts that were interactive. So if we were posting about creating a tranquil space, we would ask people to share or make pictures of their tranquil space. So really fostering that interaction on our page. In case you didn't know, if you have a professional Facebook page, you can schedule your posts in advance. And that's been really important to managing the timing and that goes into this kind of work. So you can schedule them in advance. And if you are allowed to spend money right now, you can also pay to boost your posts. We're not able to do that, but I know that is a strategy. Something that worked out really well for us because our Facebook page is relatively new was asking our partners to share. So our county communications and media, our social services departments, our libraries, our police department, they shared, and when they shared, of course, our reach was much greater. So that was really important to us. We also, like Anton, had Resilience Week and promoted that really heavily, again, in partnership with our local trauma-informed care network, our libraries, our county learning informant center, our county wellness program, and social services. And we created videos. I put in the chat kind of where you can go to see those videos, and sent information out by Facebook and email. Our partners at the library sent it out by Instagram. So we had a good reach, over 26,000 people overall of our Resilience Week campaign, which was so timely. It was already scheduled for that week in May, but that was a perfect time where people were kind of in quarantine fatigue. And so really appreciated, I think, getting that boost and that focus on resilience. And we also worked with our school partners to create a series of videos for parents. Those are also at that link I posted in the chat, and those are focused on mental health and parenting topics. The school system pushed those out, and we pushed those out ourselves. Next slide, please. Another thing that we've been really focused on is opioid prevention and harm reduction. We had to change our strategies on that pretty quickly. We were in the middle of our Don't Be an Accidental Drug Dealer campaign, which is focused on safe storage and disposal of prescription drugs by disseminating disposal pouches and lockboxes. And our primary dissemination point is our 10 county libraries, who stopped being open to the public, but shifted very rapidly to curbside pickup. And so we shifted to curbside pickup with them. So citizens were able to still request those disposal pouches and lockboxes through the libraries, and then the libraries would put them out for people to pick up. So that was successful. And then we needed to move to mobile Revive training. So we really wanted to make sure people were getting education about how to recognize and respond to an opioid overdose, and had Narcan available to do that. So the picture you see here is a socially distanced Revive we did in a library parking lot. So we just set up a tent and advertised our hours, and we served them one at a time, and we did the rapid Revive with them and then gave them Narcan. Our opioid outreach specialist has also been partnering with our local recovery centers, our methadone clinics, to do rapid Revive there and distribute Narcan, as well as going out to some of our residential motels and other areas that have high rates of overdose, and doing kind of one-on-one Revive with Narcan. As you can see, she's equipped with the mask and gloves and cleans everything in between. That was something that was really important to us. We have seen an increase in opioid overdoses during this time, because we know people are likely using alone more often, but wanted to make sure we could do what we could to influence that. Next slide, please.
So we've really been focusing during this challenging time on what we're calling the 3 Ps of prevention. One is partnership. We have been heavily relying on our existing partners and our new partners for 2 different things. One is to get the word out about our services. In the media, it says Chesterfield County is closed. Well, we know that's not true. It's just closed to people coming into the buildings. So I know myself personally, I've been relying on my pediatricians, my schools, county agencies to let families and other professionals know that we're working virtually. We're also collaborating with new partners to provide our services. We've been working, like Melissa said, with the libraries, the schools, and most recently we've been partnering a lot with our extension service to be able to provide the services that we know our citizens need. We also have practice and perseverance. Practice, again, I want to shout out to everyone who has helped me and the rest of our department with this whole technology thing and going from 0 to 100 in like 1 second, it seems like, to make sure all of those tech needs are met so that I can provide and the rest of my colleagues can provide the content that we need for folks. I've also been practicing a lot for myself just on how to present virtually. Melissa can attest. I'm kind of a theatrical, move around, act out with people kind of person. And now I'm having to present the same information in a little box. So I've really allowed myself time to practice. How do I present topics that I've been presenting for a long time? How can I present them virtually? I've also allowed myself schedule in my day to practice these things. I consider that just as important as serving a family, because if I don't practice that skill, I'm not going to get it. And with perseverance, just for me, I know our department has different ways we're keeping ourselves ready to persevere through all of this. My mantra has been, I'm going to get this. I'm going to understand this. I'm going to figure this out. We're working together to be able to do that. Melissa mentioned the resilience videos. I will tell you a story about me quickly. I was in charge of 4 of those videos. I was the person in them, and I filmed them on my phone in my home because that was the option that we had. And our camera guy came back and said, nope, that we need to redo that. And here's what you need to do. And I did it. And that's okay. Those first ones did not go out. He gave me the tips that I needed, and we made the video redos. So I encourage everybody throughout this challenging time, as we're trying to be innovative and trying to reach the citizens of wherever we are, to keep that positive attitude that we can learn some new skills and get the prevention out there to the folks who need it most.
Great, this is Carrie Lynn again. So I'm just going to share some unique things that I've heard from coalitions we're working with across the country. So I have a couple of examples from other states. So the first one is from Washington State, the Pomeroy Partners for Healthy Families. There was a coalition member who learned that because of COVID, the food bank could no longer reuse grocery bags. So I know here locally, we often take our Kroger bags over to the food bank and then they can reuse them. But because of the risks of COVID, the food bank couldn't reuse those donated bags. So they were going to need to use their own budget to purchase bags in order to serve the families at the food bank. And as many of you have probably heard, food banks are kind of really in need right now. So the coalition member brought this up to the coalition, and the coalition then printed 600 paper bags and 100 insulated bags with their substance use prevention and mental health promotion messages, and then donated them to the food bank. So because of this partnership, they were able to assist the food bank with a need, and then also provided an opportunity for the coalition to share their messages. So it's just, again, an opportunity to see how coalitions work within the community and then can help meet needs and then also get their messages out. The Alcohol and Drug Abuse Council serves a rural area known as Deep East Texas, and they planned and implemented a drive-through celebration for the National Prevention Week. The coalition advertised via PSAs, Facebook, YouTube, and even the television. They had Card My Yard post prevention messages, and then they had their mascot, Leo the Lion, come to the event. You can see in the pictures there were lots of cars that drove through, and they had things to kind of draw people's attention. They were able to distribute prevention materials, and kids were thrilled to have a safe way to get out of their house and do something kind of fun. They had over 350 people attend the event. So many states have loosened their restrictions on alcohol sales because of the pandemic. And so now many states are allowing pickup and delivery of beer, wine, and then even these mixed drink kind of packages that they're able to distribute now. So bars and restaurants can do pickup and delivery. So in order to prevent sales to minors and discourage adults from providing alcohol to minors, a coalition in New York is now working to distribute 21 means 21 stickers to those bars and restaurants, with the idea that they're going to put these, essentially a sticker shock type sticker on those to-go orders or those pickup orders and delivery orders of alcohol, in order to make sure that they're still getting their message out about providing alcohol to minors. They are also sending letters to local bars and restaurants, reminding them about the laws regarding sales to minors and encouraging ID checks for delivery and distribution via to-go orders of alcohol. The Palm Beach County Substance Awareness Coalition has really tried to use their relationships with the youth and other things to kind of go online. So they are doing a webinar Wednesday where the youth are leading the webinars. they're providing community service hours for the youth and then promoting the webinars via various social media platforms. They're also using a gift card giveaway for anyone who completes the post-test survey after the webinar. So they're encouraging kind of kids to participate that way. They do an annual youth summit, which is usually a big event that is live. Unfortunately, they weren't able to do it. So they've integrated TikTok and other social media to get youth attendance up. And they're offering 5 hours of community service for kids who complete an essay after the event. So that way they can encourage kids to participate and then have some way to know that the kids were participated and they can give them those hours.
Great. Thanks, Carrie Lynn, and all of our community members for sharing lots of great ideas and really creative ways to engage with communities during this time. This is Julia Simhai again. Like I mentioned, I work for Omni Institute. I'm a researcher and evaluator who focuses a lot on substance use prevention. So for this portion, I'm going to share a little bit about how we can use data to move forward from this point with prevention. So many of you may be familiar with SAMHSA's Strategic Prevention Framework, or the SPIF, and have used it to guide your prevention strategies before. This is a data-driven process, and so I think it's really helpful as a lens to think about how we can adapt strategies in our practices. If you aren't familiar with the SPIF, there are tons of resources available with really in-depth information. I'll just give a really quick overview for today. You begin at the top with the assessment portion to look at population needs and resources and readiness to address a topic of interest, in this case, substance use prevention. This is followed by capacity building, during which you want to bulk up training and get technical assistance so you have the knowledge and skills to plan and do work in the area. In the planning phase, you identify strategies that are going to work. You often would create a logic model to look at what strategies will be implemented and the expected outcomes. And then you'll implement what you planned. And then the last part of that circle is evaluation. Although you're typically thinking about evaluation in other phases so that you can plan for it and implement it, this is really where you sit down and reflect on what's working and how to adapt to begin the cycle again. Overlaid in the center are sustainability and cultural competence. These are designed to be incorporated through every step of the SPIF to really make sure you're able to sustain the work in the community and you're providing services and strategies that match the population and are culturally competent. So with that really brief overview, I'm going to move now into each step of the SPIF and talk about how to think about it and how we can use it in this new prevention environment as a result of COVID-19. Starting with assessment, this is where we're looking at a lot of data, and we know that data is really being impacted right now. Some of our big national and state surveillance data won't reflect this for a while because there's big lags and when that data comes out, but eventually we'll see what's going on in this period. And things like the Youth Risk Behavioral Survey, which is collected in schools, might also be impacted just by the nature of people not being in schools like they used to. So we'll have to continue to monitor those big data sources and look for emerging needs. And when the data does come out, we'll also have to be really savvy consumers of it and use context to interpret it. An example I've heard recently is that reports of child abuse tended to drop during the stay-at-home orders, which on the surface seems like a positive impact, but is more likely a reflection of the fact that people who would report those things, like teachers or doctors, weren't seeing children to notice the abuse and report it. So that's just an example of how we'll have to really be thoughtful about what was going on in the world and the context when we look at data from this period, because the surface story might not be the true one. In the meantime, while we're waiting for all that long-term data, there are lots of current real-time data sources that we can look at to identify community needs. Some data sources haven't been interrupted, things like overdose reports and treatment admissions have, for the most part, continued during shutdown periods. So looking across the continuum of care can be a great way to get a pulse on what's going on and where prevention will be needed. There's also tons of data collection going on in communities from state and local public health agencies and other school and community organizations collecting data to understand community needs and attitudes towards reopening. Even newspapers and local news sources are doing some of that. So these can be a starting point to help you understand how to structure prevention, what your community might be interested or ready for. And if you work with a coalition or some other data committee, they can be great partners to help identify sources and do that work to interpret them. In addition, it's really important to look beyond the traditional substance data sources and broaden our view of prevention to be multidisciplinary, to look at shared risk and protective factors, ACEs, other social determinants of health. We know that what's going on upstream there right now is going to have a downstream effect on prevention needs. So we'd be smart to be looking upstream right now. Moving into capacity, remember that even if your old staff or your skill sets worked great, things have changed. So you'll need to reassess some of those areas and identify where those gaps are. There's basic things like new technology or the art of online facilitation, but there's also content areas. If you are moving further upstream, maybe you're not as familiar with that area of work and need to do some skill building. So really thinking about what skills and trainings you need and seeking out ways to get those. It could be through training, or it could be looking at community partners who you can collaborate with to fill those needs. Bringing youth on board. We heard a few examples of how youth are really great participants in especially reaching other youth. And so just thinking creatively about where to gather skills and resources if it's not just within your existing team. I'll talk a little bit about planning and implementation together. A few things to keep in mind. First, for many people, addressing basic needs and equity is going to be the first priority, and we have to think about those pieces first before they'll be able to engage in sort of regular prevention work. So for example, in youth, that might mean addressing some of those upstream factors that have been exacerbated during extended time at home. Another thing to keep in mind is that best practices are only best in the environment in which they were tested and shown to be effective. And in many cases, those environments don't exist or have been really significantly altered. So that means you'll have to adapt the practices to match the environment. And there are obvious changes like switching to a virtual format, but there's also stuff like changes to content, language, and dissemination that need to be considered. And some strategies will do great when they're adapted, and some may not work as well. And we'll just have to feel that out, and it can go both ways. And so this is a lot of work to do all this addressing basic needs and adapting best practices, but you don't have to do it alone. There are other stakeholders in the communities. There's youth, there's coalitions, other organizations. So talk to them, find out, what ideas they have, what they've seen work other places, and get a pulse for what they think will work for your initiatives. And finally, because so many other organizations are in the same boat, there might be opportunities to partner and plan together, especially if you're focused on those shared risk and protective factors. There's a lot of overlap and opportunity for collaboration. And that will also ensure that you're not duplicating resources in the community. And in many places, resources are pretty tight right now. So you don't want to duplicate if you don't have to. Finally, I'll talk about evaluation. So evaluation can be a big help during this time to understand what's going on and how things are going. Even if you didn't have a consistent way to document prevention activities before, start now. It's never too late to start evaluation. And like I mentioned, you might do it earlier in the spiff in those steps, but if you didn't, that's okay. Just start now. And you'll want that to be able to show how agile and adaptive you were during this time. You can start simple. document what you're doing, how many trainings, how many sessions, how many people attended. Many of you might recognize this as process data, and it lays the foundation for your evaluation and can help support future funding needs by showing what you're able to do and who you're serving. And if you are already collecting process data, don't stop. Things might be going up or down right now, but to have that long-term trend of what was happening before, what's going on now, and then in the future, what's happening will be really, really helpful for you and your community to plan. Another important piece of evaluation is going to be asking for feedback from participants or your community. There's a lot of adaptation and new things going on, and so we really need to be honest with ourselves about reviewing successes and challenges. And this could be a really simple feedback survey that you ask participants to fill out, but just knowing how things are going is really important. Some are going to work, some might fall flat, and that's okay. But if we can understand, what's not working and make adjustments or move on from strategies instead of wasting more time or resources, that will be really valuable in the long run. And finally, there's a lot of opportunity here for innovation, like we've talked about, and some of this innovation is maybe for the better for the long term and has improved our old ways. So maybe we improved outcomes or made it more inclusive of diverse groups or made participation more realistic because of the logistics. So some of these changes are probably worth keeping for the long term, even if we are allowed to go back to how things were before. So definitely take the time to think about where those nuggets are and what you should keep, and capitalize on this period of sort of forced innovation for the long term. So that was a really quick rundown of all the steps of the SPIF and how to think about it. We know that new prevention needs will continue to emerge. A lot of our ongoing practices will still serve us well, and we can be nimble in our strategies and our evaluation to respond to what emerges over the coming months and year. So with that, we've got a little bit of time left. We'll open it up to Q&A and discussion. Several of you have already submitted some answers in the Q&A feature, so we'll be trying to answer some of those, and please feel free to continue adding if you have them. And we also have a few resources here that might be helpful to explore in prevention work, just as a starting point. And please feel free also to reach out to any one of us from today's presentation for more information. We're happy to share. I know we covered a lot in a short amount of time.
So it looks like we've got a question for Shakira. It asks, where did you get your icebreaker activity ideas, and is there a good source you would recommend?
You said icebreaker, right?
Yes, icebreaker.
Okay. So honestly, some of my icebreakers come from my mom. She does them a lot with her company, but sometimes I just go to Google and I type in virtual icebreakers. And, a lot of articles will pop up, and I'll look through them and try to choose one. And so I would just Google icebreakers.
Great. It looks like there's another question. I'm not sure who this would be directed towards, but probably one of the Virginia CSBs. So how is the best way to get youth involved? I know this is an issue that prevention providers have even before COVID, is how do you get youth involved? So if any of the CSBs who are on feel like you've been really successful in getting youth involved, feel free to answer this one.
This is Anton. One of the ways that we get youth involved is bringing them to the table where we already have adults. So bringing that youth voice to the table, asking them what way, or we're having conversation, we're creating a program or something, and then what way do they see this working for their peers or themselves? And then also having that separate coalition or organization for them to share their ideas and really listening and putting into action what they want to do, creating the programs for themselves, for their peers. And that's one of the ways that we get youth involved. And always having, if we were doing in person, having food or having some type of incentive or certificate hours or anything that they can help build them and fill their needs along with filling our needs.
I would echo that, and I would also say for us, we try to encourage them to tell their friends. I know for the social distancing challenge that we did, I did a press release. I did about 3 different interviews. I contacted the school, and that information had been passed out. I also posted it in virtual parent groups for our area, again, on Facebook. So Facebook and social media is a really resourceful tool, especially Facebook, because most kids and most students do have them.
Great, thank you, Shakira. I did want to address some of the questions that were moved to the answered column in the beginning, if that's okay. We had a question that came in, I believe this is for Anton, around, can you discuss a little bit more about the substance abuse prevention media campaign?
Yeah, so currently we have running on our radio with Intercom Radio on 15-second and 30-second ad that's just addressing right now opioid. And then September we have one playing for suicide. So it's just giving little facts, little details, and some resource resource websites and phone numbers to our agency. And then also we have some playing, well, we were playing in the movie theater. Now since shut down in the movie theaters, we've moved it to over-the-top TV, where it's streaming on Hulu and other streaming services. So that same 30-second ad, that's giving some more resources for our peer warm line or national suicide prevention lines, and just giving some facts about our CSP and how we address opioid or suicide or substance abuse.
Thank you, Anton. Another question that came up is, I believe this is directed to Shakira, but other CSBs can answer too. For using social media platforms, do you use paid promotions? And if so, how much do you spend on average?
So this is Shakira speaking, and sometimes we do use paid promotions. I would say maybe like once every few months, and I'll spend about $30. It's not very expensive, and you can choose your demographic, so your age range, what area that you want your campaign to, I guess, which area of the city per se that you want your ads to pop up in. I do not do that for Twitter, and we also don't do that for Instagram. We do have a meetup page, and that is $99 every 6 months to maintain, and I think we have maybe almost 50 young adults who have joined the meetup group.
Thanks, Shakira. So we are at the end of our hour here. I know several of you have submitted questions. If we didn't get to them, we'll try to follow up with all of you, and we'll also be sending out an email with access to the slides in recording. Please feel free to reach out if you have further questions or want to be in contact with Omni or CPG or any of the communities you heard about today. We're really grateful that everyone was able to join us and that we were able to partner with all of these groups in Virginia to share this information.
Thanks, Julia. And thanks everyone for participating today. And thanks especially to the CSBs who took the time to get things together for this presentation.
Okay, have a good day, everyone.